The Ghana Health Service says the recent hikes in COVID-19 cases in the country is worrying. Speaking at a news conference, the Director General of the Ghana Health Service, Dr. Patrick Kumar-Boaji, said the threat of a third wave is real in Ghana if urgent measures are not taken by all to address it.
The emergence of new variants with high infectivity further complicates the currently observed and currently observed non-adherence to COVID-19 safety protocols. Other threats include the outbreak of cases in the neighboring countries, surges in Ashanti and Greater Accra, which is the main hotspot in Ghana, low vaccination coverage so far, and the entry of the Delta variant into the Ghana, and lastly, but not the least, outbreaks in some of our schools. The threat of a third wave in Ghana is very real. Evidence from other countries that have experienced a third wave indicate that the cases are usually twice or three times the cases of the first wave. There has been a gradual increase in cases over the past weeks. For example, between the 11th and 25th of April 2021, a total of 968 cases were recorded for the 2 weeks period, compared to 2,500 recorded from the 1st to the 14th of July 2021. The increase in cases have largely been from the major hospitals, Accra, Greater Accra, and Ashanti region, with a few sporadic outbreaks in other regions such as Volta and Eastern regions. The rise in cases is of concern to the Ghana Health Service, and this necessitated the strategic meeting of senior managers and our partners to address the increase in these cases.
As both Greater Accra and the Ashanti region have confirmed the presence of the Delta variant among the population, health professionals say there's a need to strictly go by the protocols. The Ghana Health Service thus organized a 2-day crisis meeting to strategize on the best ways of tackling the pandemic in Ghana. After the meeting, the service has then come up with some key recommendations.
On the areas of vaccine, importance of vaccine in limiting the transmission cannot be overemphasized. Ghana is increasing its capacity to handle different brands of vaccine, including those that require ultra-cold storage facilities. Ghana is trying to source more vaccines to cover as many people as possible, and will be prioritizing hotspot areas, districts, highly populated areas, and at-risk groups, that is persons over 60 and above, as indicated in the earlier guidelines. Ladies and gentlemen, despite all these efforts, vaccine hesitancy needs to be tackled so as to ensure the maximum vaccine uptake when the vaccines are available. On our points of entry, we are recommending the use of the introduction of rapid diagnostic tests for all points of entries, so that the trucks and the cargo that comes in, which carry people, will be also tested on arrival at an appropriate, at a manageable cost. We want to ensure monitoring of the situation at the Kotoka International Airport in cases, as cases arrive, and institute appropriate measures to contain importation. For our seaports and land beaches, we will increase our surveillance. We'll be undertaking there. We are encouraging our fisher folk to assist us, the district to work with them. And despite all the strength highlighted in our plans to address existing gaps, it is worthy to know that, irrespective of the well-planned actions, an increasing number of new infections over a short period can overwhelm the health system and may further worsen the outbreak. It is imperative that the general public revisit the 4 key measures to prevent COVID-19 in Ghana. The public health measures needed to prevent transmission remain the same. What is needed is adherence to this protocol by all.
With funerals being considered as one of the super spreaders of COVID-19, the Ghana Health Service says it is drafting a framework to guide how funerals can be organized in the country for protocols to be strictly observed.
After the 2-day strategic meeting by these health professionals from across the country, what they have resolved to is that if indeed Ghanaians do not adhere to the COVID-19 safety protocols, a third wave will be looming. For Citi News, I'm Edward Upon Marfo. Kumasi.